My name is Madhukar Malhotra. I am the project chair for this medical mission. This is the fourth medical mission to Ethiopia. The first one was in the year 1919, second one was in 2013, the third one was in 2015, and this is the fourth one in 2024. We are a 25-member team with 18 doctors and volunteers and one technician. And let me share with you that this technician has already made equipment worth $500,000 operational in the two hospitals, and by the time he leaves, I hope he will touch the $1 million mark. We have orthopedic surgeons, we have urologists, we have pediatric surgeon, we have laparoscopic surgeon, we have plastic surgeon, and we have a dermatologist with us because we are aware that there is a lot of skin issues there from previous missions. Every surgery needs an anesthesia, so we have their own people. I mean, they are more comfortable working with them.
My first mission to Ethiopia, but seventh to Africa. Previously, I've taken orthopedic teams to Cameroon, Madagascar, Malawi, Rwanda, Zimbabwe, etc. And this time we've come with extra, I'll say the biggest ever team of 5 orthopedic surgeons, including me. I'm handling all ankle and foot cases and trauma and joints and orthopedic infections. Another colleague is handling only bone tumors, cancers of the bones. Another person is handling pelvic trauma, and there's one who's doing spine endoscopy and one sports medicine. So we are a team of 5 orthopedic surgeons.
It's a vocational training team. So you give hands-on training to the surgeons, but you also give them theoretical knowledge and information, and these sessions have been very well accepted.
It's been about 6th day today, 7th day. It's been very productive. We've done over 30-35 surgeries already across all these fields which I've mentioned. It's always never enough, we know that, but a beginning is made, and that's why we call it a VTT mission, where we work with our local colleagues. We learn from them, we impart whatever we know, and then we leave all the instruments and implants behind.
We have completed till yesterday about 75 surgeries, and there have been about 15 training sessions for the doctors.
Everything is new, every day is new, every theatre is new. People are wonderful. Obviously, it's a win-win for all the three, the patient, the local surgeon, as well as me. And why go far? Even in the last 6 days, there are 3 cases which I've done maybe once or twice in my 30 years of practice. Like there was one very severe club foot in a 35-year-old woman who hasn't got married because she couldn't walk on it. So we took up that case 3 days back, and we could straighten it completely in a single sitting. She's overjoyed, and that gives me a lot of thrill. The other one was, I just told you, infection of the heel bones. It's extremely rare, and you need special way of handling it. You need bone cements which are antibiotic loaded.
I am Dr. Kuldeep Dhawan, Medical Director of this mission. So this is from 11th of August to 22nd of August in Addis Ababa. So right now I am in St. Paul Millennium Medical College, and this is the Department of Urology. Here we are in a campaign, and we are doing challenging cases over here which are routinely not being done over here. So this gentleman, this is done by my friend Dr. Manoj Sharma, who is a specialist urologist. So this is a case of retained stent in the kidney along with multiple calculi in the kidney. This was a difficult case, and we did single stage total clearance of stent as well as of the stones. So like this case, we have done lot many other cases, challenging cases.
I am Dr. Milind Joshi from India. I am a pediatric surgeon and pediatric urologist. This is my second visit to Ethiopia. I have been here via Rotary Club in 2015. At that time we worked in General Hospital, GD2 Hospital, and this mission was long planned. And this time for pediatric surgery program, our aim was for introduction of laparoscopic surgery in children, which is not been performed here even in private setup. That was our primary aim, so that this vocational training team would have exchange of information and knowledge with the local doctors. So when we leave this country after this mission, they should be able to give these services to the Ethiopian people. Through this mission, we could donate a very small size pediatric cystoscope, which is known as neonatal cystoscope, which is used for fulguration of some deadly renal conditions, which was not available in this country, even in private setup. So it has been come into this country for the first time. And because of the possibility and the availability of this technology now, these people, they will be use this technology for the treatment of their children. That will have lot of good benefit on the outcome of surgery and the lives of the patient. Second part was the laparoscopic surgery in children, which was not done in this country, not in government setup nor in private setup. So we have done so many laparoscopic surgeries in children over here, and we hope that after leaving this country, again these doctors over here who are good general surgeons and good open surgeons also, they would be able to perform the advancements in the technology with the things that we have donated.
I am Dr. Urological. I am anesthesiologist, pediatric anesthesiologist, as well as critical care intensivist. I was working in a government setup in India and as well as in the private sector. I was in experience with pediatric and neonatal surgeries. I came here first time in Ethiopia as a VTT program through International Rotary and Chandigarh Rotary. So I am here for better outcome and safety of the patient. In children, when we carry out laparoscopic surgery, there are many physiological changes. Those need to be encountered and taken care of. As compared to adults, we don't have that much of time and what we call equipments to deal with the critical situations when children or neonate experience a critical phase. So I am here for the smooth surgeries and early recovery. That early recovery is very important as far as the children or neonates are concerned. Once the recovery has delayed, the mortality and morbidity will increase in children. So I am here to give some expert opinions and some procedures that can be followed during the neonatal and pediatric surgery.
So all the resident and faculty, they are working tirelessly in these referral hospitals. Otherwise, the standard of care is good. So this is basically exchange program. We are also gaining some experience. They are also getting good access to these medical facilities. We are exchanging the ideas. Whatever we know, we are trying to give it to this society.
In our mission, we have got a biomedical person with us who was able to do repairs of many instruments which were having small or bigger nags because of the non-availability of the maintenance, structured maintenance. So because of the member of team who is a biomedical person, he has been able to perform repair of these instruments. So many things, they have been becoming functional, which will be utilized for the service of Ethiopian people.
I like to emphasize on some things, those drugs which have been new to them. So those are safer when it is compared to the other drugs that is used previously here. So we have introduced that drug, we have just given the demonstration, how safe it is, how faster the recovery of the patient. So that will provide better outcome of the patient.
This is Dr. Masrasha. I'm an assistant professor of urology in St. Paul Millennium Medical College. First of all, I would like to thank the Rotary Club, the Ministry of Health and the Ethiopian Airlines for collaboration to give us this opportunity. So there are two urologists, one pediatric surgeon and one laparoscopy surgeon who just came from India with the Rotary Club. So they also brought us a lot of urological instruments, so which is also assisting, which we have also lacked for the previous 2 years. So we were not able to do some surgeries. So recently we were doing open surgeries because we had lack of instruments. Now they have brought us the instruments and the skills.
From this mission, the patients will get benefit, the surgeons, the hospital, as well as the anesthesiologist and critical care medicine, that will improve.
We were also doing for the past 1 week on operation theater. We have prepared 2 operation theaters and more than 68 patients were prepared. We're doing 7 patients, 7 surgeries per day. It is taking from morning to the night. So we have started laparoscopic nephrectomy, laparoscopic assisted pyeloplasty, and PCNL and URS also have been done. So urethroplasty we were doing, but we had lacked fine instruments, so they have brought us, thanks for them. We have 10 urologists and 10 urology residents in St. Paul Hospital. So most of them are participated in this campaign. So they are getting both knowledge and skill transfer.
So Ethiopian peoples, they are very receptive, they are gentle, and they are remarkably professional in their work. We have got a very good cooperation of the local doctors from Department of Pediatric Surgery and Urology and all the hospitals, and we have been very happy for working with them.
We also have a new machine called Eurofrometer, which was not available at all. So which is also a good source and a good support for our patients. So we're great that these urologists and the pediatrics and laparoscopy surgeons are here, and by giving us a lecture, by skill transfer and knowledge. Also we thank the Rotary Club.
I'm Dr. Bharat, a consultant plastic surgeon. I'm part of this vocational training team to Addis Ababa, Ethiopia. Plastic surgery team comprises of 3 plastic surgeons besides myself, Dr. Ravindra Bharati and Dr. Vigneshwaran. Both are expert microvascular surgeons from Ganga Hospital, Coimbatore. And so far I'm concerned, I'm a consultant plastic surgeon. I specialized in cleft care and burns management. Since it's a vocational training team, they had already selected and screened the patient, complicated problems of various parts of the body for tissue transfer, and they had kept it for us. And we are here, we saw that, and jointly with the local team, the local plastic surgeons, we are doing the cases. Now the cases are of various types. They are complicated defects. Now we had been operating, doing the taking the help of specialties like microvascular surgeries and others. Dr. Ravindra Bharati has done a very complicated nose reconstruction, traumatic nose reconstruction, and after this I am going to do a skin grafting of a huge raw area of the genitals and lower abdomen.
Brachial plexus means the entire upper limb goes flail due to the cutting of the nerves. So in microsurgery what we do is we reconnect other nerves to that so that they later get some useful movements in the hand.
My name is Dr. Maklit, and I'm a plastic and reconstructive surgeon, and currently the head of Department of Plastic Surgery in Alert Comprehensive Hospital. So first we would like to thank the Rotary Indian team to come and visit us, and Alert was one of the hospitals nominated for the plastic surgery campaign, just because we had a lot of plastic surgery cases that are referred from all the country. So we do have complex cases and we do have a long procedures done. So that's why the team joined us. It's a privilege to have this expertise with us.
The plastic surgery department of this hospital is already doing a reasonably good job, but we are augmenting it by training the junior doctors, nurses and technicians. Now this training is done by hands-on training during surgery. Now there is also a closed circuit television in the corridor of the operation theatre, and details of the surgery is seen and they are discussing it with the surgeon inside the operation theatre.
India being one of relatable country in terms of the patient population as well as the type of pathologies that are similar with our country, the surgeons are experienced with what we face now. So the knowledge and skill transference was very good.
That there is one myth people have, the community has, that plastic surgeon deals with only beautification. But that's not correct. Plastic surgery is reconstructive in nature, restoring normalcy in a deformed or disabled part of the body. And that we are concentrating here. We hardly have attended a cosmetic surgery here, very few.
ማሴተር ማስል ትራንስፈር ነው ተደረገልኝ። ኦልሞስት ፋሻል ፓርሲ ለ6 ዓመት ነበረኝ። ማሴተር ማስል ትራንስፈር ተደርጎ አሁን ያለበት ደረጃ ላይ ነው ያለው። ከ3 ሳምንት በኋላ ከዚህ በላይ ለውጥ ይኖራል። ፊዚዮቴራፒም ስለሚጀምር እስከዛ ለውጥ አለ። አገልግሎቱ በጣም ጥሩ ነው። እኔ እንደመጣ ካርድ ነው አወጣ። በሁለተኛ ቀን ተሰራልኝ። በጣም እንትን ቅልጥፍና ያለውና በጊዜ ነው ደረሰኝ። ይሄን ቻንስ ደግሞ ከዚህ በፊት ኢቭን ውጭ እጄ እንደሰራ አድቫይስ ተደረገ ነበር ስላልቻልኩ ነው። እዚህ ደግሞ በዛ ካምፔን ተሰራልኝ። በጣም ደስ የሚል ነው።
አደጋው ሹፍርና ነው የነዳው ነበር። አጋጣሚ የተባረረ ጥይት ነው የመታኝ። በቃ ድንገተኛ እንደዚህ ሆነ። አሁን ይሰራል ሲሉ እዚህ መጣው ሰሩልኝ። ያው ነርቡ መበጣጠስ መሰለኝ ስብርም አለውን ሲያጥንቱ ያው ሰርተውታል። አዎ ከእግር ላይ ነው ከሁለቱም እግር ላይ ብለውኛል። ነርቡ ተወስዶ እንደዛ ነው እንሰራለን ያሉ መጀመሪያ ይሻልኳቸው። እነሱ በመገኘታቸው ደስተኛ ነኝ። ያው እነሱም እዚህ ያሉትም የኛ ዶክተሮች በመተባበራቸው በጣም ደስ ብሎኛል ከምንም በላይ።
Now we are getting, I must say one thing, that we are getting an excellent support and hospitality by the Ethiopia team.
Many of the colleagues I met here from Ethiopia are already trained in various parts of India. I met some from Coimbatore, some from Mumbai, some from Ahmedabad. In my town, in Chandigarh, there are 3 Ethiopian residents. I meet them every month over the meeting.
As far as India, our healthcare facilities are becoming good, excellent day by day because of the advent of coming up of all these equipments and technology. So we are doing excellent work in our country. So we want to deliver whatever we know, we want to deliver it to the developing countries and wherever we are needed.
It was truly satisfying to be the part of Rotary VTT medical mission from India to Ethiopia. I extend my sincere gratitude to Ministry of Health, Ethiopian Airlines, the Rotary family in India and Ethiopia, our Rotators, management and team in the hospitals for the collaborative effort that made the mission successful. We look forward for such missions for the benefit of our brothers and sisters in Ethiopia. These missions not only help individuals but also strengthen international partnerships and foster a spirit of global solidarity.